Mary Adams, an educator. Here with me is Dr. Michael Zucker, a retired alternative medicine doctor who now consults on chronic disorders.
Well, hello to all who want some help.
Diabetes has become so common, even in younger people. Why is this?
Well, it's a complicated question. I think that everybody would agree that nowadays our food supply is not as high quality as, let's say, 150 years ago, when people were on the farm eating things that they grow, etc. Most of the problem here is nutritional in diabetes. There's a diabetic diet that is suggested, but I feel it is not quite right for all of the types of diabetes or low blood sugar that we see out there. Now, if people ate really well and they had a proper anti-stress program in their life, there will be less trouble, but there would still be some diabetes. There are other things going on. We live in a chemical world. Everything we do seems to involve use of chemicals, and a lot of them synthetic, which the body does recognize as not native and somewhat harmful. So I say we live in the excited states of America. And that means that there's all kinds of overstimulation occurring. And this is stressful, and the body has to cope with it. And sometimes it has trouble, and it starts to degenerate, come apart. Now, there are other kinds of stress going on, of course, as well. There's emotional stress, there's physical stress, even electromagnetic stress. For these types of trouble, I have in general put people on what I call a quiet diet. And that is designed to decrease the stresses and decrease the intake of chemicals and harmful materials, and to put in, through good foods and supplements, what is missing and needed for body repair and structural integrity.
What are diabetes type 1 and 2?
Well, it's interesting. They're both called diabetes because it can lead to urine containing too much sugar. The urine is not supposed to have any sugar. Kidney holds it back. But if there's way too much sugar in the bloodstream, some of it can't be held back and ends up in the urine. And that's the origin of the word diabetes. That means flow through. There are two types of diabetes, which are quite different. The first is what we call juvenile diabetes in younger people, mostly in children. This is an autoimmune disease. In other words, the body is attacking its own cells. And it attacks, in this case, the cells in the pancreas that make insulin. Insulin is needed in order to get blood sugar into the cells for use. And if you don't have that insulin, then blood sugar stays very high. This is generally caused by virus, and it kills off these cells. Now, there's another type of diabetes, which is far, far more common and becoming more and more common, and that is type 2. This is a degenerative condition where there's not enough insulin activity in the system, either by not producing enough or by not using it in a correct way at the right time to go along with the sugar, or there is a problem in the sugar not going into cells in spite of insulin's presence. In other words, there's some sort of blockage at the cell surface, so it doesn't work. These are all a problem. What is the main problem? Well, as time goes on, if the blood sugar stays high, it causes certain kinds of changes with glucose, and it causes the blood vessels to deteriorate. So you end up getting vascular disease, or what we call plaque. And this happens at quite an early age. Generally, it will start in after about 10 years of uncontrolled blood sugars. And of course, it attacks the usual bad places, the coronary arteries of the heart, the vessels of the brain, and in diabetics, it involves quite often the artery to the eyes. So they have problems with blindness. They also have trouble with circulation in their legs, and they commonly develop ulcers in the legs, and this can lead to gangrene, as you all have heard. So it is a very serious disease, and it's important to have an understanding of what it is, what causes it, and what really can be done about it.
Is there a disorder of low blood sugar too?
Yes, there is, and believe it or not, this is actually far more common than diabetes. That's a pretty incredible thought, because we know diabetes is now affecting something like 15 or 25% of the population, of the adult population. So what in the world is low blood sugar about? We call it hypoglycemia. Instead of diabetes, is hyperglycemia, meaning high. Hypo is low. Well, it's all really part of one disorder. It's a spectrum of effects. I call this something a little different. I call the overall problem glucose-insulin malregulation, because there isn't a proper balance between the glucose that needs handling and the insulin secretion and activity. There's something out of balance here. And if you do a test called a glucose tolerance test, you can see all kinds of curves of what happens when you give people a big dose of sugar. And the general test is a 5-hour test with samples of blood taken at the start before you take in sugar. And then at 30 minutes, 1 hour, 2 hours, 3 hours, 4 hours, 5 hours. And you get this interesting curve. And now what's supposed to happen is you start with a fasting blood sugar, which is hopefully normal. Sometimes not, it's high. Let's say it's 100. And then you give somebody this big slug of the glucose solution as a test. And at a half an hour, you see a substantial rise. And at 1 hour, you see a maximal number. Maybe it goes up to 130, 150. And then what happens is insulin gets secreted and it starts to counteract this, and down comes the blood sugar, and it should come back down to the same level it was before you started the test, the fasting level, and stay around that. However, when people are getting in trouble with eating sugar and caffeine, alcohol, or maybe they get obese, you start to have disturbance in this curve. And early on, generally what happens is you start to have the sugar go too high at 1 hour, and then it doesn't come back down properly by 2 hours. Now, during this time, insulin is being secreted, and there's a good balance. However, when trouble sets in, often the blood sugar just keeps on going up, and this insulin output is slow or not enough. So it keeps on going higher and higher, and it may stay very high, 300, 400 more even, for several hours. It may never come down. And the problem is, earlier on in the stage of this disorder, often the body does recognize there's too much sugar, and it starts to catch up. It tries to catch up by secreting a lot of insulin. And then in many cases, what happens is at the second, third, fourth, or fifth hour, this great amount of insulin that comes out actually pushes the blood sugar down below what it should be. So it's a regulatory problem. And this is not too big a problem if it's mild, but if it gets down fairly low, the body has to do something about it because the brain needs sugar. The brain basically runs on sugar. Now, if the blood sugar goes down really low, like 50 or even 40, there's a mechanism in the body to generate sugar internally from the liver. And that is a big boost. Now, the way it's done is you secrete adrenaline from the adrenal gland. The adrenaline acts on the liver. It breaks down something in the liver to liberate sugar. And then the sugar slowly starts to come up. The problem here is twofold. First of all, Adrenaline is very stimulatory, as anybody knows who's had a fright or a sudden stress and upset. It causes you to feel shaky, anxious, angry, often hard to think clearly. It may give you a huge headache. It can do all kinds of things to the system which are unpleasant. Matter of fact, we call this a hypoglycemic attack because it feels like there's something terrible happening to you. And of course, what does one do when you feel this coming on? You tend to try to run and get some sugar somehow, and that will tend to back it away. Now, sometimes, however, after a while of doing these kind of reactions, the body is not able to pump out the adrenaline anymore. And so the sugar goes down and it stays down. It may stay down for hours. And that affects the brain's function. And it makes people feel tired, unable to think, and very uninterested in things. That is a problem for safety, as well as if the body is full of adrenaline and feels shaky, etc. So this is a significant problem. Now, how significant? I said it was more common in diabetes troubles. I find over the last 20 years in particular of my alternative healthcare practice that this is the single commonest chronic complaint people come to me for. And there are all kinds of ways the body has trouble with this. It may be their nerves are discharging in strange ways, giving complaints. It may be that the muscles are cramping and you have all kinds of peculiar pains. There are all kinds of ways this shows up. Skin can react with a lot of secretion and things that shouldn't be there. So this is extremely common. We really need to put more attention on it. But unfortunately, the medicos out there have decided that this test is really not worth doing. We can do another test called the glycohemoglobin or hemoglobin A1C, which measures a 6-week average blood sugar. And that is very useful to see how people are controlling their diabetes. However, it is not useful to see if there is a problem with low blood sugar. And there is a good reason to be doing these tests, but they were kind of abused by alternative care docs for some time. And because standard docs don't really understand the correct therapy of it, which is nutritional, they tend to say it doesn't exist or it's rare, and it's not. Now, unlike the diabetic diet, which reduces the sugar, alcohol, caffeine, and doesn't really even talk about quality of nutrients or supplements, the hypoglycemic diet also eliminates a lot of these things. It should add in good megavitamins and minerals so the body has whatever it needs to function smoothly. And in addition, it is very important to eat frequently with some protein, preferably, and you can also have fats, because these things stabilize the blood sugar over time. They're gradual release and turn into sugar in the system. So every couple of hours, a person should be eating a little something that will prevent these dives of the blood sugar level, glucose, to very low numbers, which provoke these attacks.
We've heard about the diabetic diet. Is there a different one for hypoglycemia?
Well, as I've mentioned, they are somewhat different. They start sort of similarly, but it's very important to make sure that you prevent these attacks. So you need to get in there and de-stimulate the system, put the right materials in, high quality things, a lot of organic foods are good, proteins, good quality meats, and poultry, fish, or if you're vegetarian, high quality organic nuts and seeds. And if you have dairy, some organic dairy. These things give you the protein and some of the fats that are needed and don't irritate the system excessively. So the effort should be to destimulate the pancreas, which has gone a little bit haywire and having trouble synchronizing with the blood sugar, reading the right amount at the right time to prevent trouble. Now, on these diets, generally blood sugar will normalize to some degree. If a person has a serious problem with high blood sugars and diabetes, generally this kind of a diet and supplements will bring it down substantially. May not get rid of it entirely, but it can reduce the need for insulin, for instance, which is an annoying injectable, somewhat risky proposition, because if you inject too much insulin, you'll get low blood sugar, hypoglycemia, and you can go into a coma. Just like if blood sugar is too high, you can go into a coma called ketoacidosis, and that is very serious business.
Medicare is now trying to reduce the skyrocketing price of insulins and oral diabetes drugs. Is there a better way?
Well, you have to understand that the basic thrust of modern medicine is towards drugs, surgery, radiation, etc. And because we're not trained particularly in real quality nutrition and supplements, there is not much attention towards using that as a program. And instead, there's a quick rush to use medication. Now, I'm not against medication. I was trained in using medication. We did real well. We never had a person die from ketoacidosis. We got in there quickly and fished them out. But we're in a phase now where the pharmacy industry, which we could call big pharma, just like big brother government. Big pharma is out there making enormous profits, and they've been jacking up the cost of drugs enormously ever since we got people onto Medicare drug prescription coverage. This is unfortunate, and the government is trying to rein it in a bit, starting with the insulins, which are important for life. But we have to contend with this constant advertising on TV and everywhere for drugs, to go ask your doctor for drugs. And doctors, of course, are being told by pharmacies and representatives that the drugs are very important and good. Now, they are important and good, but we've gotten into a situation where the very complex drug regimens of insulin have prevailed, and they're very expensive. And it shouldn't be this way. It should be kept fairly simple, but this is not the way that the authorities want it to be. So I do feel that people often need to have their medications for diabetes, but we should try to reduce it as much as possible. And that can be done with what I call my quiet diet, which cuts down the sweets, caffeines, alcohols, and highly processed food, chemicalized foods, etc. And in addition, there are some herbs that have a partial effect to lower blood sugar, but they're not really a replacement for a proper diet. Exercise, however, is very good in a diabetic situation. Why? Well, of course, it has natural health-giving qualities, as we all know, and it burns calories, which is good. But when a person exercises, they do not need insulin to get the blood sugar into the muscles or anywhere else. This is the body's way of making sure that muscles get what they need to do exercise. So you don't need as much insulin if you're doing more exercise.
What about the current diagnosis of prediabetes?
Well, it's good and it's bad. It didn't used to exist. Now we have also pre-hypertension, or elevated blood pressure. But the idea behind labeling things like this is to identify people who could then be put on the standard medical regimens, which are really not enough for these kind of problems, but they tend to pull people onto drug regimens. I think that's unfortunate. A person who has a blood sugar that's a little bit elevated can almost certainly be controlled just with diet and supplements and proper ways to manage food. I'm very much interested not in the quantity of foods that go in, the carbohydrates, proteins, fats. I'm particularly interested in the quality of that food because we want the body to get the best materials that it can use for repair and smooth function and for metabolism. And diabetes, low blood sugar, these are really disorders of metabolism. They are hormonal disorders. There are other hormones involved beside insulin, but insulin is the kingpin. And so this is a hormonal disturbance, and it's a glucose and insulin malregulation problem. Now, there is a risk of not doing anything about diabetes, as I've said. It's a very serious condition. So it is important to identify it properly and then put in a program promptly to move it in the right direction.
What do you call your special diet?
Well, I call it the quiet diet. And I've written a large book called Health Truth, which dispels a lot of the lies and myths that people have been taught over the years by various important people in their lives. And about 100 pages out of this are devoted to nutrition. Nutrition in this disorder is the key. Detoxification is important, hormonal management is important, but nutrition is the key. So I call my diet the quiet diet because it destimulates and it allows better repair. Now, the key elements are what I call the proof, P-R-W-F, proof. P stands for pure. That means not chemicals or anything else added. And it's organic food, that means. That's number one in our chemical world. Number two is R, stands for raw. Raw foods are important because we are raw, our bodies, for the most part. And it's important to give it things that are supportive and cooperate with it. So raw foods of various kinds are very important. And most people have gotten to the point of not eating very much of those. The W is for whole foods. You want all of the nutrients that are designed to be in it so that you get the most efficient use of the food. And least important is F, fresh. Well, you don't want to eat food that sat around a while and deteriorated or maybe even gotten toxic, as with proteins, animal proteins. So I say P-R-W-F, those are the keys. And then you have to have some tolerance for what you eat. So if you're allergic to something, you avoid it. And you also have to operate with moderation, particularly in the low blood sugar area. You have to be very moderate and control carefully the intake of things that will provoke trouble. Also with diabetes, you have to be rather careful, but it's not as critical. So the quiet diet works very well. I find that it's the linchpin, along with supplements in high dose. And with this approach, 80 to 90% of all people with chronic disorders, of whatever kind, develop great improvement. I say major improvement, at least 50% improvement in the largest complaint that they have.
Thank you for your devotion to controlling the problem of glucose insulin malregulation, an ever more common disorder.
Well, I'm glad to give out health truths to everybody.